Mesa County Public Health sees themselves as the system builder of this work. So we pulled together a lot of the key stakeholders in behavioral health in the community. The summit originally had a lot of the executive level attendees. We had state representatives that came out, and that was really just focused on kind of the funding side of things. What do we need to do now? What can we do now? And then we have the Behavioral Health Steering Committee that's in the works. They've been meeting for, I think, about 6 years. And with some turnover that had happened at the Mesa County Behavioral Health Department, it was just the right time for that group to take on this work. So it's a lot of providers, it's the people doing the work. And so that's the power. If you're doing the work, you know where the problems lie. We wanted to be able to get this momentum in 90 days, but the big focus that came from the group is that it needs to be sustainable. We cannot put a Band-Aid on it. It needs to be permanent, sustainable solutions, and that's really what the work is going to be moving forward. So we're looking at anything from establishing crisis stabilization centers to how we can share data across the behavioral health continuum to improve the client experience as well as the provider experience, because if you don't have the information you need across the continuum, that's really where the breakdown starts to happen. Mesa County Public Health has established a behavioral health division, and so they're really going to keep carrying on this work. The work doesn't stop at 90 days. It's going to continue.
I'm a licensed social worker, and I've been in our community working in various pieces of social work, mostly education for the past 25 years, working in the nonprofit sector mostly. And I would say the clinical skills are the newest part of my background that I've been using in the last several years. Behavioral health is an important part of community whole health, and Public Health Department recognized that it's needed. And if we're looking at through the public health lens, it made sense to bring behavioral health into the mix as part of that work.
Behavioral health is important because it impacts everyone, and it impacts a lot of your health outcomes, not just the mental health side of things. It starts to impact physical health, economic stability, a lot of those key health outcomes that we look at Mesa County Public Health. Mesa County Public Health, in partnership with the Behavioral Health Steering Committee, has formed an education campaign called Find the Right Fit. And so you can go on to the website findtherightfit.org, and it has different examples of my loved one needs help or I'm feeling this way, and it'll connect you to those resources that fit into those categories. It uses plain language, so it's easy to understand. And we've got our fun little raccoon mascot because the idea is just like the right pair of jeans, you need to find the right fit for your mental health care.